The way most nursing students are taught to study pharm is fundamentally broken. The body is just a really advanced biological machine, and drugs are chemical levers we pull to adjust it. Once you see the system underneath, you stop guessing on exams and on the floor. I actually break this whole system down in way more depth in my guide. Links below, but let's get straight into it. 1. Pathophysiology before pharmacology. You cannot understand how a drug fixes a machine if you don't understand how the machine broke in the first place. If a drug's mechanism of action isn't clicking for you, that's your sign to stop staring at the drug card and go back to the disease. Example: heart failure is fundamentally the heart struggling to pump fluid forward. Once you get that, the pharm basically writes itself. Need it to squeeze harder? That's a positive inotrope. Need less fluid to pump? That's a diuretic. Need the pipes more relaxed so fluid moves easier? That's a vasodilator. The disease dictates the drug every time. 2. The Rosetta Stone, the autonomic nervous system. If there's one thing to lock in above everything else, it's this. Learn the ANS and you unlock about 50% of all pharmacology without even trying. It's the control board for the entire body. 2 sides, sympathetic or adrenergic, fight or flight, heart rate up, airways open through bronchodilation, pupils dilate, gut shuts down. Parasympathetic or cholinergic, rest and digest, heart rate drops, saliva and gastric juices flowing, bladder contracts, airways constrict. Once this is locked in, you stop memorizing side effects and start deriving them. See a drug labeled anticholinergic, like atropine, don't memorize its side effect list. Just ask, what happens if I block rest and digest? Answer, the patient dries up, dry mouth, constipation, urinary retention, blurred vision. That's it. That's the whole trick. 3. Master prototypes, not individual drugs. Never study 100 drugs one by one. Study the 15 to 20 primary drug classes. Every class has a prototype, the OG, most representative drug of the family. Learn that one deeply, and you basically already know 90% of every other drug in its class for free, and you can clock a drug's entire class just from its suffix. Drugs ending in PRIL are ACE inhibitors, and they lower blood pressure. Drugs ending in OLOL are beta blockers, and they lower heart rate and blood pressure. Drugs ending in statin, and they lower cholesterol. Drugs ending in DIPINE are calcium channel blockers, and they relax blood vessels. And drugs ending in prazole are proton pump inhibitors, and they reduce stomach acid. 4. The mechanism to side effect pipeline. Side effects are not random trivia bullet points. They are a direct, logical extension of the mechanism. The second you connect mechanism of action to side effect, it's permanent. You stop needing to memorize it. Think it through. Opioids depress the central nervous system to kill pain, so the side effects are systemic depression across the board. Respiratory depression, decreased gut motility leading to constipation, and sedation. 5. The pendulum principle, overdose and withdrawal. Stop making separate flashcards for overdose and withdrawal. They're the same pendulum, just swinging opposite directions. Overdose is the drug's primary effect taken to a lethal extreme. Opioids slow you down, so overdose looks like respiratory depression, coma, and bradycardia. Withdrawal is the exact opposite of the drug's effect. The body forgot how to function without the drug holding it back. Opioid withdrawal is tachycardia, extreme anxiety, diarrhea, and diaphoresis. 6. Map the plumbing and wiring group drugs by the biological system they hit and picture that system as a machine. Think of the cardiovascular system as plumbing. You've got a pump, the heart, pipes, the vessels, fluid, the blood volume, and a drain, the kidneys. Pump too weak? Give an inotrope, like digoxin. Pipes too wide or collapsed? Give a vasopressor, like norepinephrine. Tank overloaded? Open the drain with a drug like furosemide. If blood pressure is tanking, just ask, which part of the plumbing broke? 7. Filter everything through the nursing process. Med students learn pharm to prescribe. You're learning it to keep the patient alive. For every prototype, run these 4 questions every time. Pre-assessment. What do I check before this pill touches the patient's hand? Apical heart rate before digoxin. Potassium levels before furosemide. Contraindications. Who does this drug hurt or kill? Never give a non-selective beta blocker to an asthma patient. Interventions and evaluation. How do I know it's working, and what am I watching while they're on it? Patient education. What are the top 3 things this patient needs to know before they walk out the door? Don't stop this abruptly. Avoid grapefruit juice. 8. Study in scenarios, not vacuums. NCLEX and the actual hospital floor do not care if you can recite a textbook definition. They want to know what you do with a deteriorating human. Start running scenarios in your head. 65-year-old male, heart failure, history of asthma. Doctor orders propranolol. Do I give it? Why or why not? That forces active retrieval and safety checking. Literally the exact muscle you need as a working nurse. 9. Triage. Your side effects. Textbooks list 20 side effects per drug. Trying to memorize all 20 is a fast track to burnout. Master students sort them into 2 buckets instead: the nuisance or expected effects, nausea, mild headache, dry mouth. Educate the patient, but it doesn't stop you from giving the drug. The lethal or adverse effects, the actual deal breakers. Stevens-Johnson syndrome, a severe skin reaction. Agranulocytosis, which wipes out white blood cells. QT prolongation on the EKG, which risks a fatal arrhythmia. Highlight the lethal and the weirdly specific stuff, like rifampin turning urine orange. That's a classic, highly testable patient education point, the Feynman Technique. If you can't explain a drug's mechanism, its primary use, and its main danger out loud, in plain language, in under 60 seconds, you don't actually know it yet. Close the book. Stand up. Explain why an ACE inhibitor lowers blood pressure like you're talking to an actual patient, not a classroom. That's the whole system. Building out these mental maps for every drug class does take some time up front. If you want to do it yourself, take these frameworks and start applying them to your notes. It will completely change how you study. If you'd rather just have them already made for you, I actually put this entire system together in a guide called NCLEX Pharmacology, the logical blueprint. It has all the visual loops and mechanism breakdowns we just talked about ready to go. I left a link and a discount code down in the description if it sounds like something that would help you out. Either way, stop trying to memorize everything, trust the logic, and I'll see you in the next video.